Today's an exciting day, folks. We're joined by Christopher Frenz, who's a healthcare cybersecurity pioneer who is implementing zero trust even before most people knew what that meant. You see, it's not the fact that Christopher has a massive contribution that makes him different. It's that while in a sea of people are chasing the next shiny object, Christopher has been going back to the roots of the problem by asking questions like, do our controls actually work? And today he delivers his best tips to medical device manufacturers on how to build secure devices that thrive on the market. Christopher, welcome to the podcast.
Thank you for having me.
It's wonderful to have you. So you've published a lot of work under the medical device cybersecurity field. Can you tell us a bit about the background of all this?
Sure. I guess I came from a biomedical background. That's how I got my start in healthcare. So I started as a drug designer about 25 years ago. I used to do computer algorithms to design pharmaceuticals, and over time got more and more interested in security. In particular, medical device security, I became involved around the 2016 timeframe, which is when I wrote the first version of the OWASP Secure Medical Device Deployment Standard. Later went on to help co-author the Cloud Security Alliance Medical Device Incident Response Playbook, as well as some other work in the medical device space.
Oh, wonderful. Can I ask you what sparked your interest in the cybersecurity piece of medical devices?
Sure. I became interested in cybersecurity back around 2004. So one of the interesting things was I was writing applications at the time to design pharmaceuticals, and I really began to notice how both the code I was writing as well as that of my colleagues really didn't factor security into the applications themselves. So I started to become interested in, I guess at that time, AppSec, and that kind of developed into more, general interest in security, and kind of over time shifted more and more away from the research end of things and towards the IT and the security side. So it's a long process to get there, but I was the early adopter of security in biomedical sciences.
For sure. And if in 2004 we were missing the cybersecurity element in medical devices within the coding piece, what do you think is the missing piece that we're missing today?
The missing piece, I would say, I think security is getting much better. I think there's more of an awareness of security. But one of the areas I think in healthcare that you're lacking security is the integration with clinical context. So I think if we look at a lot of clinical systems or medical devices, we'll talk about protecting the asset, like is it publicly exposed? What kind of data is on the asset? We consider more traditional definitions of risk, traditional cybersecurity definitions of risk. We don't really take into effect the patient safety aspects. So if you take something like a CT machine, if it goes down because of a ransomware attack or something else, it's not ideal, but at the end of the day, you reschedule a few patients and it's an inconvenience at worst. That same CT machine in emergency room setting, and now you can't triage stroke patients, and it's a huge issue. You have to go on diversion, and it's a big patient care impact. So if you have limited resources, one of those CT machines clearly needs more protection than the other. And I think that's one example. I think we need to start to apply more and more of that context to figuring out how we protect certain devices within healthcare. And the other side of things, if something were to happen, we need to use that kind of knowledge to inform our incident response processes.
Mm-hmm. Absolutely. I want to get back to that incident response piece because it's something that you've written in depth. Why does it matter?
Incident response, or in terms of...
incident response of medical devices. There's two pieces of it. You can either you can do your best so that doesn't happen, or you can respond into when the accident actually happens.
I think both are critical. I think you need to put a lot of effort into preventing incidents from happening. But at the end of the day, you need to be prepared in the event something does happen. And one of the reasons I think incident device for medical response needs more attention and more thought in a lot of cases is you can't use a one-size-fits-all process when it comes to medical devices. Like take, for example, a common incident response process of often organizations will disconnect the device or unplug it to prevent something from spreading. That might be perfectly acceptable for a PC, but you can't do that if it's a patient hooked to a respirator. You have to take a different process. And that's kind of a crude, obvious example, but there's a lot of nuance to how the organization has to respond to different types of devices going down. So for example, a telemetry monitor, you can probably safely disconnect it from the network, but you may need to increase nurse rounding, so it has an impact on workflow. Other medical devices have different issues surrounding whether you can disconnect them or not. And so what we tried to do in the Cloud Security Alliance Medical Device Incident Response Playbook was encourage the collaboration between security teams and clinical teams in order to figure out how to respond. And we tried to do that by also classifying devices into different device categories based on how disconnectable a device was from both the patient as well as from the network. And we kind of break it up into different pathways you could follow based on how you classify the different types of devices.
Okay, that makes sense. There's different devices that must be treated differently. In terms of preparation, so it's always hard to think about something that you don't want to happen, but if you want to understand how your device should prepare for a potential cyber attack on it, what are the first steps that the medical device manufacturer should take?
On the manufacturer side, one thing I would love to see is more and more threat models for how different devices could be attacked. I think that's some of the context we lack today. And that applies to the protective side as well. So if we understood better the different threat avenues for how a device could be attacked, A, it lets you on the protection side know what controls you should put around the device in order to protect it. But B, it also helps you plan for what could go wrong if the device is attacked. So one of the things I would love to see from the medical device manufacturers is more and more transparency around what the threat models are for a particular device. How can that device be attacked? What the impact could be if the device was attacked? And I think that would be kind of the next evolution of a lot of the medical device standards. So rather than taking a one-size-fits-all approach, you can kind of customize the controls you put around the device to suit the particular needs of that device type.
When you say you, who are you referring to?
In that case, I meant the healthcare system who purchases the device, because they're the ones who ultimately deploy the device and have to put the compensating controls around it.
But, wouldn't there be a risk if a medical device manufacturer would share his or her threat model that it leaks and then someone could more easily abuse it because it would understand the threats of a specific medical device and might give them ideas on how to break into something?
There is that potential argument, and I will admit there is a potential risk there. But overall, I'm always bigger on transparency. I think it's better to be transparent, and I think you would be better off if you were transparent about it, because some of the organizations could take the efforts to protect themselves. Otherwise, the risk still exists. It's basically security through obscurity, but it doesn't mean that the risk is not there. I think you can better protect against something if you know what the risk is than if you're unaware of it.
Yeah, absolutely. And maybe you don't need to go into the details absolutely of the most critical thing. Just having an idea of the basic scenarios is perhaps something that you need as a healthcare institution to understand a bit more of the threats that are imposed on a medical device. So,
And you can find the balance point too. Like, I don't necessarily need to know the exact step-by-steps of you have to do this, this, and this in order to successfully exploit the device in this way. But if I know that the device could be exploited in this way, it does help me design compensating controls to put around the device.
I wonder though, how much time and how much resources do hospitals actually have to dedicate to a particular device they're going to implement within the hospital?
I think that varies from hospital to hospital depending on the size of the hospital. Your bigger hospitals more capable of doing it than your smaller ones. But overall, that's one of the reasons I think that kind of information should come from the manufacturer is the typical hospital probably does not have the staff or the expertise to do the threat modeling.
And so, how would you go about if you know your medical device is going to be in the smaller hospitals? What are the things that you would prioritize to make clear for the hospitals or for the clinics that only have a little bit of time to dedicate to hardening or putting controls onto the medical device?
First of all, I'm very big on all organizations making some type of security review for medical devices part of their purchasing process. So I think it should be incorporated into the purchasing decision. I think the more and more hospitals that start to vote with their wallets and ask for things like SBOMs and MDS sheets, it'll help push the direction that organizations want more and more secure devices. So I think a security review should be a big part of the purchasing process for all organizations. But aside of that, I think hospitals need to think about what they're going to do once they actually purchase the device, and they need to think what controls they need to put around the device, because today's perfectly secure medical device is going to be tomorrow's legacy device that's going to have all kinds of security issues. These are long-lived devices. So I think organizations do need to be conscious that they need to not only look to buy secure devices, but even if the device is currently a secure option at this point in time, they need to think about the controls that still need to be around the device, because 5 years from now, it's not going to be that perfectly secure device anymore once there's no more patches and a lot less support for the device. So I'm very big on controls like zero trust. I've done a lot of work in that area. Big on controls like DNS syncholling and a variety of other controls to put around the medical devices in order to keep threats contained as well as identify potentially compromised devices.
Hmm. Yeah, it's a very good point. I think we'll get more into this. I want to get first into the purchasing department. What would it look like to evaluate a device cybersecurity before purchasing it?
I think, again, it's going to vary somewhat by the size of the organization. Your bigger organizations tend to be a little more capable at evaluating the devices. At the very minimum, I think organizations should be asking for security paperwork on the device, what kind of controls are built into the device, what kind of controls are lacking from the device. They should be asking for things like S-bombs from the device, questions like how long the device is going to be supported. There's a variety of security questions that every organization should be asking as part of that process. I think more mature organizations can ask for information about, or even ask for a sample of device maybe to test and put it through some testing to actually see how it's going to stand up against attacks. But I think that's something that only your bigger hospitals are capable of. Your smaller hospitals, less so. So it will vary from organization to organization, but the bare minimum, I think security needs to be part of the decision-making process for organizations. And they should be doing evaluations on the device, particularly with how long it's going to be supported for, how quickly patches are going to be made available, and a variety of other questions like that.
Hmm. Because for cybersecurity in organizations, there's certain standards. We have ISO 27001, we have SOC 2, things like this. There's no talks of anything like this for medical devices, no?
There are some standards coming out. I know the IEEE is actively working on one. So there is some standards moving in that direction. The FDA has some guidance for manufacturers in that direction as well. So things are moving in the right direction. The issue a lot of hospitals face is even with a lot of the standards coming down the pipeline and things getting better because of those standards, the problem is they kind of make tomorrow's device secure. They don't really help the hospitals with all the devices they already have deployed. And if you look
Hmm.
at most hospitals, there's something like 10 to 15 devices per bed within the hospital in terms of medical devices. So the typical hospital has hundreds, if not thousands, of medical devices already deployed. And security getting better with a device they're going to buy in the future is great, but it doesn't really solve the problem of all the devices that they already have. And that was actually one of the original reasons I, back in 2017, developed the OWASP Secure Medical Device Deployment Standard. It was to address the issue of what controls could be put around a medical device within a hospital in order to improve the security of those devices.
Hmm. Yeah, absolutely. There's a lot of things that can be put in there. I wanted to ask about if medical device manufacturers are wondering what it usually looks like to update a medical device. Let's say one of the 15 medical devices that are attached to the bed. How would it typically work for an IT person to update this device on the bed, for instance?
That actually varies quite a bit from manufacturer to manufacturer.
Hmm.
So I've seen vendors have everything from the ability to centralize your patch from a server that controls the devices to other vendors where you have to go with a USB drive or something from to bed to update the device. So there's a lot of variety there depending on the manufacturer. Long term, I would love to see things move to a more centralized model. I think it makes it easier to deploy patches, control the deployment of patches, make sure you don't miss one. But we're not quite there yet with a lot of vendors. It's still often a very manual process.
And do you think it should be controlled by the hospital themselves, or should manufacturers take a service kind of approach where they would take care of the updating of the devices for you?
I think the hospital definitely needs a voice in it. I mean, who actually, pushes the button to deploy the patch, I think is less relevant than being able to schedule when the patch goes out. For example, a lot of devices you can't risk bringing down if there's a patient attached to it. So the hospital definitely needs a voice in this device can only be updated between these hours on this date because it won't be in use then. That's not something a manufacturer can do without consulting with the hospital. I think in terms of whether it's done in-house or done as a service, the appetite for that's going to vary from hospital to hospital. I can see
Mhm.
bigger hospitals wanting the more control to want to do it themselves, but a lot of smaller hospitals who don't have the manpower are appreciating the offering as a service. But I think the major factor is the hospital needs a voice in when the patch itself would actually be deployed, just so they can schedule their patients around it.
Makes sense. I think you know where I'm going with this. It's controlling when updates happen, and if updates happen, reminds me of the CrowdStrike incident where an update was pushed to a lot of computers all at once, and turns out that this was not a good update. What did you reflect as a healthcare professional who takes care of medical devices? What did that make you think of?
I think it highlights the need in general for cyber resilience to be part of everyone's planning. As cybersecurity professionals, we need to think about what happens if security tools or various systems within the organization fail. What are the backup plans going to be? Part of that goes back to the incident response conversation that we had earlier, but a lot of that also goes back towards defining proper architectures within your environment. Because one of the interesting things I think about CrowdStrike is it made a lot of organizations aware that security controls can fail. But what I find interesting is that security controls fail all the time in ways that most people don't think about. The reality is that was a very obvious big security control failure, but misses of detections and other stuff happen very routinely. Security controls fail a lot more often than people think. So
Can you
one of
tell
the things
us
I'm
what
a
a
big,
failure yeah, go ahead.
I say one of the things I'm a big proponent of is taking a more evidence-based approach to security. The former scientific background, I really like to measure security. I like to actually try to quantify whether security works or doesn't work. And I've become really big over the last 10 years on trying to develop ways to measure control efficacy, to ask the question, do I not just have this control deployed, but does the control actually work? Because I think one of the big problems with security today is a lot of security is graded based on checklists. So you look to achieve compliance with a certain standard, and those standards usually ask for the existence of a control. I have a firewall, I get 5 points, which I'm not saying you shouldn't have a firewall, but having a firewall and having a firewall with all the proper rules and policies to do good egress filtering are two totally separate things. And I think oftentimes we don't check with enough granularity. And I think taking a more evidence-based approach and measuring control efficacy kind of forces you to look at, do I have that control deployed in a granular enough way to actually be effective? And I think that's something that we miss a lot today.
And if you're a medical device manufacturer and you want to implement this kind of quantification of your controls, what would it look like?
For the manufacturer side, I think it involves actually putting the device to the test, is seeing how well it can withstand different attack scenarios, and also being transparent with the hospital that the device won't stand up well to this type of attack unless you also add this compensating control, whether it's network segmentation or whatever the control happens to be. Kind of going back to that threat model we talked about earlier, is you need to tell the hospital what architecture needs to be built around the device in order to keep the device secure.
Yeah, makes sense. Our architecture is important. Threat modeling is a big piece of this. What are some things that you wished that medical device manufacturers would communicate more with you in terms of, we've seen the S-bombs, we've seen the threat models. What are some things that we can do after the product has been released, once it's already in the market?
I'd almost love to see the industry go more modular long term, where you have the ability to replace your pieces of devices. So let's say that way you don't have to replace the whole MRI machine simply because the computer runs Windows XP or something else like that. So you see a lot of that kind of situation where the computer is tied to the device and there's no way to replace just the software components or just the computer component without being forced to replace the whole device. So long term, I would love to see the ability to modularize some of that stuff so you could address some of the information security risk without necessarily having to reinvest in a whole new device. I think that would be a very interesting direction for the industry to go. It would allow you to achieve a lot of the cybersecurity goals without having to constantly replace new devices, which is cost prohibitive for most organizations.
Yeah, absolutely. And from a business perspective, I'm a person that started from business. Would it make sense to make medical devices a more of a licensing kind of deal? How would you feel? But you're a cybersecurity professional, but what's your thought on this?
You said in terms of licensing devices as opposed to
Like paying like a SaaS service for medical devices so that there's more incentives to keep devices up in the long run.
I could see that being appealing in some circumstances. I think it is a business decision, like you mentioned. So I think it would take the hospital modeling it out to see which particular cases that would work to be more beneficial than owning the device outright. But I could see there being some appeal for that in certain device types. And you are seeing more and more SaaS components appear as part of a lot of clinical systems. So I don't think hospitals would be completely opposed to the idea.
So in terms of development of medical devices, you have a bunch of them that you need to keep up for the response of it. How medical devices manufacturers need to figure out how to prioritize certain actions within the response teams. How do you advise them to do and complete the preparation for this medical device if it were to fail?
In terms of the device manufacturer role, I think what would be relevant is how the hospital would have to respond to the device failure, and what does the device fail open? Does it fail closed? What fail-safe mechanisms exist in the device? So whenever you have a device fail, it's going to impact workflow in some way. I think it would be, how does it impact the workflow? The organization would need to know, so transparency around that, and what could be done to mitigate the failure of the device. Is it swapping out one infusion pump for another? Is it something different? What is the way to deal with the potential failures that occur? So I think transparency around that would be helpful in those situations.
Yeah, transparency. I think you're advocating for a lot of this. A big part of the conversation around product development lifecycle is the fact that it's emphasized by CISA and the FBI around their product development best practices is to start shifting from developing products in a way that they're open by default into closed by default and then opening up as per a hospital need. What's your thought on this? Would it help hospitals, and what would be the challenges with such an approach?
I think overall, that's a good approach to most things. I'm very big on least privilege type approaches, zero trust techniques like that. So I think having to opt into greater communication or greater features for the device is not a bad idea from a security perspective, because a lot of the misconfigurations in a lot of device types, not just medical device types, is people forget to shut those ports down or turn whatever feature it is off that they're not using. So it would eliminate a lot of the vulnerability and attack surface that you get from people just forgetting to do basic stuff. So I'm definitely not opposed to that approach. And I do think having the minimum amount of function turned on and having to opt into additional features is not a bad way to go about things. It's like taking a system hardening approach to any OS. You shut down all the unnecessary features, and having that be the default state is not something that I would be opposed to.
Yeah, absolutely. And who usually does the hardening? How a device is implemented within a hospital, within a clinic? What does it usually look like?
I think that's one of the areas where it gets tricky, and actually one of the areas where you could have improvement is each device is often a specialty within itself in terms of how the device functions. And the average biomed department in a hospital, which is dealing with all kinds of different devices, is not going to have the expertise to harden any one particular device type. So that's definitely an area where the manufacturer can play an increased role in keeping the hospital safe, because the knowledge within most hospitals is not going to exist to know that I can safely turn off this feature or close this port without breaking the device. And that's something that really needs to come in terms of guidance from the manufacturer as to how you could harden that particular device.
Without breaking it down, basically.
Without breaking it, yes.
Okay, because
I
usually
think a lot of hospitals would have a lot of fear around disabling a feature or closing communications on something that looked like it was in use, unless the manufacturer provided guidance that it was safe to do.
yeah, and usually the guidance that you'll get is through hundreds of manual pages. So how hard is it for an IT person who doesn't necessarily have the time to go through all of it to find the information? Is this a pain point that you've seen as a hospital to actually implement something because of too much information?
It can be. And my experience with a lot of that stuff, once again, it varies from manufacturer to manufacturer. Some manufacturers can be very easy to work with and responsive, and others less so. So there's a lot of variety across the board depending on which vendor you're dealing with.
Yeah. So you're advocating for a bit more standardization of medical devices in terms of what the expectations are. Do you think there should be a guideline, like a cohort of medical device manufacturers that's standardized a bit the ways that
I think
medical
standardization
devices
would be great.
Yeah.
I think as a starting point, even if it's not standardized, just a way to have some kind of manufacturer specific guidance as, this is how you harden this particular model of device.
Okay, this is how you harden. Yeah, makes sense.
I'm giving a hypothetical example here. Maybe it needs, let's say, something like Telnet or FTP turned on to configure the device. But once it's up and running, maybe it doesn't need that. That's something that you need access to all the time. You could shut the feature down or block it with network segmentation or something else. Without being told they could block something that they just used, the hospital would be hesitant to do it. But if the manufacturer made it clear that this was only needed to set the device up and then never needed again, it makes it easier to make that decision to put a block in place. So I think a lot more transparency around what things are used for and what can safely be disabled, I think would go a long way.
And what if after the installation, the device could by itself turn off certain ports? Is this something that's feasible or could be wrong for it could be a bad decision in terms of the hospital's security?
I guess it would depend on if it would affect the functionality of the device or not. It's kind of hard to comment without knowing what the particular port does or doesn't do. But that kind of goes back to where the manufacturers have to be clear as to what the purpose of each feature you're opening up or each port you're opening up. What does it do? What's it used for?
And so when you set up a medical device within a hospital, for me, it sounds difficult to get the collaboration between the IT person who is setting it up versus the clinician and the patient who are going to be using the device. How does an IT person, do they just rely on the medical device manufacturer to understand, okay, this is necessary, this can be taken out?
I think a lot of it takes a partnership, and I think it's one of the things that you need to see more and more of within healthcare is the security teams beginning to partner more and more with the clinical teams. I think you need to establish the relationships and get the security team and the clinicians to work together. Because at the end of the day, security and the clinicians want the same thing. They want patient safety. And that's what the goal of all this is. But I think sometimes you need to build that bridge. It's not always there by default. Oftentimes you might get resistance to a security initiative. But if you can build the understanding of why that security initiative is important, then it's much easier to get the buy-in from the clinicians and get all the stakeholders on the same page.
Yeah, I'm guessing it's a lot of the work in the hospital context in security in general, you always have to push as to why you're doing the certain things that you're doing.
Bridge building is always important, yes.
Yeah, of course. Education. I want to end on a note where what's one thing that you've seen medical device manufacturers do that is something that you've seen healthcare organization appreciate in terms of cybersecurity?
I think one of the things is you're starting to see more and more manufacturers take a more security-centric focus. So, for example, things like zero trust and network segmentation. I'm starting to see more and more vendors actually deliver their device with some kind of firewall or something else to put in front of it that actually starts to provide some of that functionality for you. A lot of the device manufacturers are getting better about being a little more transparent about what is actually needed in order to get the device to function. It's not quite 100% yet, but it's getting easier to get things like the MDS2 sheets, get things like the SBOMs. It's becoming less of a struggle to get that from manufacturers. So I do see the industry moving in the right direction. But to reiterate, I think the challenge for most hospitals is the picture for tomorrow is getting better with the new device purchases, but you still have a huge issue of all the legacy devices that you already own. And I think that's going to be a challenge for hospitals for years to come, probably forever, because today's secure device is tomorrow's legacy device.
Yeah, wonderful. Well, Chris, thank you so much for coming onto the podcast. If people want to find out more about you, where should they go?
Probably the easiest way is LinkedIn. You can Google my name and it should pop up.
Yeah, we'll put it in the description. Great. Christopher, thank you so much for coming. We'll see you on the next one. All right. Folks, it's been an awesome episode, and I'm here to tell you about my top learnings from this episode. The first one is that threat models are important for the law, but they're also very important for medical device manufacturers. And as cybersecurity becomes more and more important for regulators and for hospitals, sharing the threat models can become a real competitive advantage to stay relevant in the market. Number two, design for modularity. So you build devices and Number two, designing for modularity. You want to build devices where components, especially software, can be upgraded independently. This addresses today's perfectly secure medical devices as tomorrow's legacy device, while creating a service-based revenue opportunities, something to explore. And number three, supply comprehensive security documentation. Don't just share it with your regulator, with your notifying body. Make sure that you share several things with your customer. That includes the threat models we talked about, but also the SBOMs, the MDS sheets, and other hardening guidelines. Our expert noted that each device is often a specialty within itself. Providing this expertise often helps customers improve their security posture while positioning your own company as a trusted security partner. I'm Matt, Cyber Doctor, and I'll see you on the next one. Please subscribe. Please. Thank you.